Hello my friends, this is Dr. De La Rosa, Manuel De La Rosa, now from Monterrey, Mexico, in this lovely garden outside. We just wanted to step out and give a nice message. And today I would like to talk about a little hint or tip for colleagues. And I would like to talk about a really common problem that we see in a private office, especially on a periodontal practice. It's a gingival recession. When we have a gingival recession, sometimes we have the question, how should we treat it? Ideally, we will get a consult from a periodontist, and normally what we periodontists will do is evaluate a recession and see what type of recession we have according to the Miller classification. It's either class 1, class 2, or class 3. But nowadays, we take into consideration several factors that are very important in our decision process. And one of them is, how is the gingival biotype? Is it a thick gingiva or a thin gingiva or an intermediate? When we have a thin gingiva, even though we have a small recession, we will tend to do, or will be more inclined towards doing a connective tissue graft to augment the gingival biotype, because it will give us the stability of the results as well as covering the recession. Now, another very critical point is the amount of keratinized tissue that we still have remaining. Sometimes we have a very few millimeters of keratinized tissue, 3 millimeters, 2 millimeters. When we have such an amount as well, it will be much better to do a connective tissue graft to gain more keratinized tissue and to gain more thickness of the tissue. These two issues will give us a stability on the coverage of the recession defect. Now, another critical point will be as well is if we have a complete papillary fill before the recession, before the treatment for the recession, because this will give us the end point of how far can we cover that recession. If we have a complete papilla, like a recession class 1 or a recession class 2 according to Miller, then the predictability will be much higher than if we have a recession class 3. So I think when we have a patient with a recession, it is very critical to evaluate the soft tissue biotype, the quantity or the amount of keratinized tissue, and the position of the tooth will be the third point. If the tooth is in an ideal position, then almost any procedure that we decide to perform will succeed if we perform it well and the patient takes good care of it. But if we have a tooth that is in malaligned position, then the results will be compromised because of this position. So I hope this information is really helpful for you on your next patient with recession, and always open to help you in case you have any question or suggestion. Thank you very much, and I hope to see you soon.